Dr. Jonija, thanks so much for joining us today. I'd appreciate it if we could start off with an explanation of how allergies are different to histamine intolerance.
An allergy is quite different. We now see histamine, we should say either histamine excess, histamine sensitivity, and histamine intolerance are all used rather loosely. But they all actually mean the same thing, which is that the body is trying to cope with an excess of histamine, and this is separate and distinct from an allergy. Now, an allergy always involves the release of histamine. So obviously, we're going to have very similar symptoms from either the histamine released in an allergy, which of course will be in excess, and that's what is responsible for the symptoms, or we have the same symptoms from histamine, which is rising in the body as a result of several other events, separate and distinct from allergy. However, the two can exist together, which means that the excess histamine, of course, can be coming from an allergy in addition to other things that are happening in the body. Now, having said that, histamine sensitivity or intolerance can occur without a person having allergy at all. So they go for allergy tests, which involves detection of allergen-specific IgE, which is the antibody responsible for allergy, and the tests come back negative. And yet all the symptoms seem to indicate that an allergic reaction is occurring. So what we have here is a situation where you have an allergy with the typical symptoms of either respiratory distress, digestive tract distress, symptoms in the skin, all of which can be mediated by the histamine released in the allergic reaction. But with histamine intolerance or sensitivity, that histamine is in excess, and therefore the symptoms are going to be the same.
Do you believe it's possible to lessen allergic reactions by lowering our overall histamine level?
That's a very good question, and the evidence seems to be pointing to the fact that yes, this can happen. But we have to look at the reasons for histamine excess in the first place. Very often, this seems to be associated with a low level of the enzyme systems called diamine oxidase, which break down excess histamine. Now, when histamine in the body reaches a level that the enzyme cannot cope with, then we're into the excess situation. Now, if a person has an allergy, and in addition has, for example, a low level of the enzyme that breaks down the excess, we then need to lower the level of histamine overall so that the body could cope a little better. Now, what I'm referring to here is research that indicates that people who are prone to having anaphylaxis as a result of an allergic reaction, which in some cases can be life-threatening, may also have a low level of the diamine oxidase, which means that the histamine being released in the allergic reaction is not being sort of broken down as rapidly as in perhaps another person. And this can reach a level where that anaphylactic reaction can be so severe it is life-threatening. So in those situations, most definitely, one can reduce the effects of the allergy by reducing the histamine. Now, that is supported by research. Whether one can actually reduce the severity of an allergic reaction in people who have a normal level of the enzyme has yet to be proven by research, but it would be logical to assume that perhaps one could.
Could you please give us an idea of how histamine intolerance, mast cell activation, and mastocytosis are different from each other, if in fact you believe that they are?
Well, actually, it's all the same thing because histamine is made, synthesized, and stored within mast cells. So the mast cells are the focus of where histamine comes from. So if for example, in a condition such as mastocytosis, we have an excess of mast cells, which of course means that we have an excess of stored histamine. So anything that is going to trigger the release of that histamine is going to lead to an excess of histamine. It's not an allergic reaction. It is mast cells which are in excess. Therefore, histamine is going to be in excess, and anything that could reduce that histamine is going to be effective to a certain degree in reducing the symptoms that result from the release of histamine from the mast cells. So that's the important factor in mastocytosis and similar conditions where there's just too much histamine stored. And then when it's released, of course, we have far too much of it. So that is definitely a histamine-associated condition, which we could call histamine excess, or not really histamine sensitivity in its sense of being due to an enzyme deficiency, but it's definitely an excess of histamine.
I was initially diagnosed in 2010 with histamine intolerance on the basis of a DAO and histamine plasma test. It was only just a few months ago that I found out that I actually have mast cell activation disorder, which makes sense in terms of the very severe symptoms I had, including anaphylactic shock. What advice do you have for people who are looking for a diagnosis, who believe that they may have a histamine-related condition?
Now, you have brought up a very important point here, and that is that we do not have any definitive tests either for diamine oxidase function or histamine levels. Now, what I mean here is that histamine fluctuates in the body constantly. We require histamine for brain function. It's a neurotransmitter. We require histamine for digestion because it's the trigger for the release of gastric acid, which is always released when we start to eat. It's the first stage of breakdown of protein in the stomach, for example. And we require it constantly for protection because histamine is one of the ways that the body fights infection or any adverse event in the body, because these events will really result in inflammation as the result of histamine release. So histamine fluctuates in the body constantly, and so a normal level would be different when a plasma sample is taken, for example, different times during the day, different events during the day. And then in addition, we might be able to measure diamine oxidase, for example, in blood, but it does not translate, never will translate until we've got far better research into what is the importance of that level in clinical outcome. For example, you could say, okay, a plasma level of diamine oxidase as such and such means that you're going to have a histamine excess. Well, that really is not the case. Diamine oxidase is different levels in different organs throughout the body. And we have diamine oxidase in the digestive tract, we've got it in the kidneys, we've got it throughout different organs at different levels. And so how these function in controlling the level of histamine and how that translates into histamine excess symptoms is totally unknown. So this, unfortunately, although it's it's actually very fashionable to take these tests, and laboratories are making a lot of money from these tests. They really don't tell us very much at all. So there we are in the beginning of this being recognized as a separate entity from allergy, but the research does not tell us exactly what this is going to translate to in a particular individual.
Very interesting that you say that, because it's something that I've personally suspected for quite some time, and it's
You
wonderful
are
to have.
correct. A lot of people are suspecting this now as they realize that, the research does not support this and does not support the way of. We're so used to medical tests. That's our problem. We're so used to being sort of told that we have to have a test for every condition we see. The test results will then determine the diagnosis. The diagnosis determines therapy, and so on and so forth. That's what we call the medical paradigm. Mm. And unfortunately, it cannot be applied either to histamine sensitivity or to allergy if we really take it to its extreme. But we're talking about histamine sensitivity, so we don't want to go into the complexities of allergy at this point. But I just want to emphasize that, no, it does not apply at the level that our research is at the moment.
Wonderful. So if somebody somebody suspects that they have a histamine condition, how would you advise that they go about confirming it?
Well, as a result of my own research and the articles I've written and so on, I've sort of seemed to have a very large practice in this particular condition, because so many people have the situation where they suspect they have an allergy, and often their general practitioner might also, because of the symptoms, send them for allergy tests. They're negative, and so they start looking for answers. And of course, on the web now, we've got a lot of references to histamine intolerance, many of which are completely wrong, but there we go. The idea is then planted, and then they will go to look for tests, because that's our medical paradigm. The tests will then either confirm, and often do confirm, because these tests are often indicative of fluctuating histamine levels, which can be high at certain situations and so on, and maybe low diamine oxidase, although we cannot specify what low diamine oxidase is because we don't have a normal level to compare it with. And so they sort of end up sort of saying, well, what do I do now? Well, when they come to me after having sort of many different routes around, what I do is to look at their history. That's very, very important. So I need their medical history. I need all the results of every test they've had. And then if the indications are, and they always keep a 7-day food and symptom record very carefully. I give the instructions and the recording chart. And then based on that, if it is clear, and often it is very clear, because I suppose I've been doing this for almost 20 years now, so, one sees this pattern very clearly, or not. And then I start a low histamine diet, very important. And then, as a result of that, which I developed over the years based on my research, then we can tell very quickly whether they have a histamine sensitivity problem, because the results are quite dramatic. And then after that, we can perhaps introduce the idea of supplementing diamine oxidase and see if that will then help their problem. But in most cases, if it is histamine sensitivity, we reduce the external sources of histamine, and that's all we can do. Then this in itself becomes both a diagnosis and a therapy.
The results of the diet are indeed dramatic. I went from believing I was on my deathbed to becoming pretty much fully functional in a matter of months. It was amazing.
Yes. Yeah, actually, I've had people come within a few days of reducing it, particularly if they are already following a high histamine diet, which many people do. Unknown to themselves, of course.
Absolutely, thinking that they're being good to themselves because they're eating all the foods that they're told are healthy: avocado, tomato, fish, shellfish. But.
Oh yes, oh indeed, yes indeed.
So that brings me to the question that I am definitely the most asked, which is which foods are safe? My response is usually that it varies from person to person, aside from the obvious ones that are agreed upon by most lists, such as the avocado, the soy fermented foods, canned fish, things like that. But that rarely satisfies anyone. Could you please give us some insight into how these food lists are created and why it is that they all contradict each other?
Absolutely. I think that's the most important question, and I'm very happy to be able to answer it for you because there's so much misunderstanding about the condition and how to manage it because people don't understand the process. And that's what I've been researching is I always go to the cause, the process, what is happening before throwing around, different lists and so on. Now, the most important thing about histamine intolerance is, and this is the biggest difference between histamine intolerance and allergy, is that histamine intolerance is a dose-related condition, which means to give you what it means is that when you exceed your own limit of tolerance, then you are going to show symptoms. So making this very simple, I give the analogy to filling up a bucket with water. We start in the bottom of the bucket with essential histamine. That will be histamine that our body makes for brain function. It makes for digestive function, protection. So we've always got a little bit of water in the bucket to begin with. Now, if a person has an allergy, for example, during the pollen season for their respiratory allergies such as hay fever, they're releasing more histamine. So that adds more water to the bucket. And then they may be consuming, for example, they may even have an allergy to cats or dogs or something. So animal dander can add a bit more to the bucket. Then they may be eating a high histamine diet. Tomatoes, for example, cheese, glass of wine, have a pizza with pepperoni. I mean, each of these are adding on to the water that's already in the bucket. And some of them are quite high and adding more and more and more. When that total level reaches the top of the bucket and overflows, that's when symptoms occur because that's exceeded their body's ability, the enzymes in their body, the ability of those enzymes to break down the excess and excrete it through the kidneys. So then we see the symptoms. So you can sort of visualize the top of the bucket being that particular person's limit of tolerance, and they filled up the bucket, overflowed, and that's their symptom trigger. So what we're dealing with is each of the different events that are going to add to the water in that bucket. So that was your question. Where are these things coming from? Multiple sources, but as long as we understand each of the source, we can control it. What we're doing is reducing that level that is above the level in the bucket that we require. So anything on top of that, especially the diet, we're going to bring down that level in the bucket. So let's look at where this histamine is coming from outside the body. This is what we call extrinsic histamine. So as you said, we've got a variety of different foods. So let's look at the foods themselves. Where is the histamine coming from? Well, in fish, for example, you buy fresh fish, freshly caught and gutted, frozen fish. Fish don't have any histamine.
Mm-hmm.
But if they are not processed adequately, if they're not frozen immediately, they're caught and gutted, then the bacteria in the gut of the fish start to break down protein. The protein of the flesh contains many amino acids, the most important of which in our discussion is histidine. Histidine is converted to histamine by histidine decarboxylase. It's a specific enzyme that these bacteria make. It converts it to, that enzyme converts the histidine to histamine, and the longer the fish is hanging around unprocessed and ungutted, the level of the histamine rises. And bacteria multiply every 20 minutes, so that histamine can rise pretty rapidly. So there's a source for the fish. We can eat fish if we have an excess of histamine, but it has to be freshly caught, gutted immediately, or frozen immediately.
People often question my use of salmon, tuna, and other high omega-3 fatty acid, darker flesh fish. Now, I personally haven't noticed any difference between my reaction to white or darker fleshed fish. Is dark fish higher histamine?
No, makes no difference whatsoever. It's the bacteria in the gut. Now, talking about canned fish, in North America, I'm pretty sure it would be true in the UK too. We have very stringent regulations regarding caught fish. It's usually flash frozen on board ship. That's fine because the bacteria don't have a chance to multiply and act on the flesh. But a lot of the fish that is canned in countries where the regulations are not as stringent can be from fish which does contain histamine as a result of the processing. So anything that is sort of coming from sources that we don't know have been processed adequately, avoid, because there is a chance of having the fish having already been broken down, the histidine and histamine risen. The other caveat with canned fish, some of it is sulfited, and sulfites release histamine by a different process, but sulfites, anything sulfited must be avoided because that will release histamine. Shellfish, we don't gut. So obviously, the shellfish are out because the bacteria in the gut of the shellfish does a similar thing. It converts histidine to histamine, and that's always a potential source of histamine. So avoid shellfish. That's the simplest thing. Now, as far as going through other protein foods, anything that is fermented or processed is going to contain histamine. So we're looking at things like pepperoni, salami, bologna, all of the processed and fermented meats are actually have amines give the flavor to them. So this is completely out because of the high level of histamine. So as far as meats on a histamine-restricted diet, only the fresh meat itself, for example, a roast or roast poultry or things like that, which are not processed and not fermented. So those are okay. And then we go to other protein foods such as eggs. In themselves don't contain histamine, but egg white is known to be a histamine releaser. So anything with excess egg white, particularly mousse or meringue or anyone where we've got a baked Alaska, for example, where the egg white is predominant, is not a good food for histamine. A small amount of egg in a baked product doesn't seem to be a problem at all.
Regarding fermented foods, how about homemade kimchi or yogurt or something probiotic like sauerkraut?
Fermentation process is going to release a certain amount of histamine. So that's where probiotics, which are in milk, fermented milk, are not a good idea. But the other protein food, which is very important, is milk. Now, milk in itself is perfectly okay. It doesn't contain histamine. But fermented milk products, of course, do, because there we've got the microbial fermentation and histamine being a product as a result of histidine breakdown or histidine conversion. So cheese, for example, anything that has a microbial culture, including yogurt, buttermilk, kefir, any of the fermented milk products are likely to contain histamine, whereas milk or cream, including ice cream, as long as it doesn't have another ingredient that's histamine releasing, and butter are perfectly okay. It's the fermented milk products that are a problem. And then we get to the fruits and vegetables. Now, some of the fruits and vegetables do have a high level of histamine or may release histamine. Now, I found a very interesting article years ago, actually, in a rather obscure agricultural literature paper, but very interesting, and I was looking into that a little bit further, and it seems that some fruits particularly need histamine for ripening. And so particularly the red ones, it seems. So things like tomatoes, cherries, even red beans for some obscure reason that I can't find in the research literature, but hoping someone will look at this a bit more closely. They need histamine for the ripening process. So, for example, people who have histamine intolerance find that they could probably eat, well, I found this, that they can probably eat green tomatoes. And there is a species of tomato that doesn't ripen. And their histamine level in that is very low or non-existent. Berries. Now, this is a different category of histamine, a source of histamine. Berries tend to be high in benzoates, natural benzoates. Benzoates release histamine. And so certain berries are higher in benzoate and release more histamine. And the berries that I see which are really problematic tend to be strawberries, raspberries, cranberries. And so all of these are, cranberries are the great sort of health food, but for a person who has a histamine intolerance, they can be a problem. So berries and the benzoate rather than the ripening process. So looking at all of these, I've made up the lists as a result of looking at the ones that are high in histamine from laboratories that have done histamine levels tests in these foods, as well as those that are likely to release histamine as a result of the benzoate level. So my lists include the vegetables and the fruits which are associated with histamine levels and histamine release. And then we come to the herbs and spices. And again, looking at these, what are we looking at? Well, in cinnamon, it's a very high level of benzoate. So again, we've got this factor where histamine is released as a result of the benzoate in the cinnamon. And cinnamon in any spice mixture, such as curry spice mixture or chili spice mixture. And then there are certain herbs that release. Thyme, for example, releases histamine.
Thyme. Now, there's one I wasn't expecting to hear. I eat thyme with almost every single meal, and it never fails to make me feel better. It's actually in most of my recipes.
Well, maybe you don't have this problem with the benzoate release. There's the thing.
That makes sense because I can't eat berries, most berries. I mean, I haven't tried strawberry in a long time, but yeah, that's true. Are there any other fresh herbs that present a problem histamine-wise?
Most of the herbs are okay. It's the spices which are problematic. Cinnamon, clove, anise, and nutmeg. But thyme is one of those that may or may not be a problem. And I suppose it depends on the species too.
Absolutely.
Yeah, so we don't have that research to tell us, but that's just another one. It's the only herb actually that is associated with a possibility of the benzoate. The other group that I haven't mentioned are the legumes, and the two which are very problematic: soy and red beans.
How about chickpeas and lentils? A lot of people seem to have got the idea that they're high histamine.
No, they're not. No,
Okay.
not really.
No, I don't feel that they are. Okay, well, that leads me to the time information that you just gave me segues into my other question, which is that a lot of foods that appear as high histamine or as nose on histamine lists also have positive attributes, including some anti-inflammatory, mast cell stabilizing, or antihistaminic properties, such as some varieties of mangoes, peaches, blueberries, and cacao. Do you feel that lists adequately address issues like these, such as how we should weigh up whether the anti-inflammatory and moderate antihistaminic attributes of a food outweigh the negatives?
Yeah, it is a matter of risk-benefit balance. It's always a factor when we're looking at therapies, whatever they may be, whether it's dietary or drugs or whatever we're looking at, really. It's the risk-benefit balance that we're looking for, where we have, more benefit than we do risk. Of the list that you gave me, mangoes are okay on any histamine list. There's no reason to avoid mango. Blueberries, these are berries. Some of them will have benzoate, some of them don't. It depends on the species, the ripeness, all sorts of things. Blueberries are sort of low on the berry list, but all berries do have a certain level of benzoate that we have to be a little bit cautious about. These are usually perfectly okay. The level or the association with histamine is not really significant. So, of the list you gave me, I think it was what else was
Cacao.
Oh, that is a problem with histamine. That one I wouldn't include. No, just to be safe. No.
Absolutely.
You see, the problem is very difficult to associate reaction with a specific food. You can do it with allergy, of course, because you eat the food, you have an allergy. There it is, clear and simple. But if you are on a low histamine diet already, the level of the water in your bucket is pretty low. It's below your limit of tolerance. And so you can eat certain histamine-associated foods, particularly if they're not very high in histamine or benzoate, and you are not filling up your bucket with water. So in this situation, you can consume these more beneficial foods and still not fill up your bucket with water, as long as you are not consuming a lot of other high histamine foods. And that's the beauty of histamine intolerance without allergy, is that you do have this sort of a more liberal type of diet, because until you exceed your own limit of tolerance, you are safe.
Absolutely, that is the foundation of my approach to my.
Oh, I'm so glad to hear that, because that is the only approach that is makes any sense or any value in histamine intolerance management. It truly is.
Yeah.
But then we should discuss other sources of histamine that people may like to know about, other than foods. I mean,
Absolutely.
yes, we control it by foods, but there are other factors. For example, this is what brings us probably to the probiotic question, and that is, many people who have histamine intolerance have the situation where the bacteria in their own digestive tract are converting undigested proteins that go into the colon. These bacteria convert the histidine to histamine so that their bodies themselves can be a source of excess histamine.
Wow, yes.
That is important because the same bacteria in the gut of the fish that convert histidine to histamine are in the microbial flora of the colon. And these people, in fact, are the ones that are likely to have excess histamine as a result of it coming from their own microflora.
Is this where we would consider treating with probiotics?
Well, let me say that this is the research that years ago I came to England to do a sabbatical, and I wanted to work on that very topic. Because what I wanted to do, I have a list of the microorganisms that we know will convert, well, actually, that we have a list of I have a list of the microorganisms that convert histidine to histamine because they make histidine decarboxylase. But I also have a list of microorganisms that synthesize diamine oxidase, which means that these microorganisms will in fact break down histamine that may be being produced by these microflora constituents. So what I wanted to do was to develop a probiotic that would sort of introduce these diamine oxidase producing bacteria and displace those that were converting histidine to histamine. We do not have targeted probiotics at the moment. We do not have those probiotics available to us, which will make diamine oxidase and colonize the microflora of the gut and displace the others. So all we do at the moment is to put in random species of bacteria and hope it'll help. But we do not have the research that would be allow us to specifically target this particular problem. That would be what we really require, is a probiotic that is targeted. I suppose that's what we would call third-generation probiotics, specifically targeting an enzyme system to displace one and replace it with the one we want.
DAO-producing bacteria, something that I'm sure many people have dreamed of.
Oh, I know the species. I know exactly which organisms to use. The only thing is that we've got to go through all the trials to make sure that they're safe in the human body before we could possibly just randomly throw them at people. Yeah. And that's the research that hasn't been done.
Well, that's too bad. Hopefully there'll be some funding for you to continue that research, because I'm sure we definitely all make use of it. Just going back to diet quickly, I wanted to ask your opinion. My personal dietary approach has been to remove high histamine foods, but as I go to replace them with high nutrient, lower histamine foods, and now eventually I've actually graduated to the point where I've been able to reintroduce higher nutrient, high histamine foods. I'm very concerned about the people who write to me telling me that they've been reduced to 4 or 5 safe foods. Could you please tell us how we can deal with this?
That is the thing that I come up against so often, and I think this is, whoever has advised them, if that's where it comes from, that's really malpractice, because whatever food I take out of a diet for a person, I always insist that it is replaced by food of equivalent nutritional value. It's the most important part of dietary practice, is to ensure that the person is adequately nourished, whatever restricted diet they're on. They should never be given a list of foods to avoid without an accompanying list of foods to substitute them with.
Absolutely. Which brings me to the question, a lot of people who are down to a few foods, what's the possibility, without saying that, because I know obviously it would upset me greatly when people would say that it was all in my head, that I was creating something that, that wasn't there. It's all in your head. Just eat it, you'll be fine.
Oh, God. I've heard that so often to the people that come to me with that. Oh, that is just pure ignorance.
Absolutely. I mean, that's not at all what I'm saying. What I am wondering, though, is there a possibility that our brain somehow becomes sensitized to an experience, a negative experience towards food, or more than one food in particular, that has caused a negative experience in the past, and that is now coloring our approach to food? Is that a possibility?
A very big possibility, and that I've seen in allergy practice through the years, because my practice is all allergy, food allergy rather, and intolerances as well as histamine, and I've seen people become food phobic. They're convinced that a food is going to make them ill or might even kill them, and so this actually results in it is anorexia nervosa in the true term, which means that the brain is literally starving the body as a result of fear of food. It is a fear. It is a phobic situation. Yeah, most definitely. My worst experience with a patient of that was a young boy, actually. He wasn't that young. He was 14. He came in with his parents, referred to me by his doctor, and he was 14, and he came in. When I first saw him, I would say he was no older than 9. He was fragile, tiny, very thin hair, wore a baseball cap all the time because his hair was so sparse. And the history was that his mother, a nurse, had taken him for allergy testing when he was 6 months old. And the allergist had done skin testing, which is never, ever one of the things I would recommend ever. But there you go. 6 months old, skin testing, and he'd come out with so many positive reactions that he was only left with about 6 or 8 foods. And his mother diligently avoided all of the other foods. She'd been told by the allergist that the reactions were severe, so he was at risk, and so until the age of 14, he'd only eaten these 6 or 8 foods.
Oh, no.
So he was literally starving, from the nutritional point of view. I mean, he wasn't starving because he was eating adequate amounts, but he was nutritionally very, very undernourished. And so the first order of business, of course, was to reintroduce foods. And I developed a program that he would start with small quantities, and we would slowly introduce foods and monitor his reactions to make sure that he wasn't reacting to the food. So they were both on, both parents were sort of on this, and so they'd got this program that they were going to start introducing the foods in a very controlled fashion. So we set up an appointment 2 weeks later to report back what had happened. And this time the mother came back only with the fun, and the situation was, and I said, well, how did you get on? And she said, we didn't do it. I said, oh, why? And she said, well, the day before they were going to start the first test, the boy had become so anxious. He was vomiting continuously. He couldn't sleep. He was absolutely in a panic mode because he had been told from the beginning that the other foods he had to avoid because he would die as a result. So he was convinced that the beginning of his testing would mean that he was going to die. And so that was an extreme case of food phobia, to the point that the child couldn't even cope with the idea of starting these other foods. I know that's extreme, but there are all degrees of that phobia.
Well, it's not that extreme. I come across it every day. Every day.
Oh, you do?
Oh yes.
Yes.
When you come across a situation like that, I mean, personally, I did reach a stage I was given an elimination list and pretty much nothing else at all, and struggled with it for a few years, just not understanding why I was getting so much sicker. And it was only once I realized that I needed to add foods back that I actually began to heal. But by that point, I had become fearful of foods and confused, because no matter what I eliminated, I was still reacting to everything.
Yeah.
Because I also
Hmm.
didn't understand that digestion releases histamine, or histamine is required for
That's right,
digestion.
exactly. Just put food in your mouth and you're releasing histamine. Exactly.
Exactly. So I learned to manage it and to get over my fear of food by approaching food as, for lack of a better way of putting it, a partner in healing. That the foods.
Wonderful. Wonderful. Yes.
So.
That's how I try to. That's how I try to approach my patients, and how to make friends with food, if you like.
Ah.
How to how to use sort of the whole psychological approach, I suppose, and yeah, I use that a lot, a
Oh,
lot.
wonderful.
But I also employ the small dose continuous exposure, and I actually talk to my patients and explain what's going on, that we have to start refeeding as if they were babies. And as a baby, they were given food. In fact, they were first exposed to food in their mother's breast milk. That's where we start tolerance. So I explain about tolerance, and then how we do the same process of giving a tiny amount in increasing quantities, and literally re-educating the body that this is safe. It's going to be integrated into your body, and we're going to sort of make it a sort of part of the process of healing. That's how I approach my patients who are in that situation.
It's amazing to hear you say that, because that's exactly what I did for myself. And with a hefty dose of meditation on the side, meditating while preparing foods, while eating, just a whole program. Is there some kind of stress relief or meditation that you recommend to your patients?
Well, I'm glad you brought up the topic of stress, because that is very important. In fact, I got this in another of my books, The Digestion, Diet and Disease, where I have discussed the whole problem of stress and given a flowchart showing where stress actually results in the release of histamine as part of the hypothalamic pituitary adrenal axis process. So stress in itself, that phobic stress around food, can release more of the problematic chemicals, if you like, to put it simply. So the process itself is contributing to the problem. So anything that is going to reduce stress is very beneficial, because that is not in your head. Well, it is in your head, but it's a biochemical process in your head. It's not something you can control. It's a biochemical process, a metabolic pathway. And that is something that I explain to my patients as well. That, this is part of what is going on, and it's part of what we have to gently intervene and divert to a positive rather than a negative response.